Welcome back to CyberClinic, where digital health meets secure innovation. I am your host, Claude Bernard, a doctoral candidate in health informatics and cybersecurity advocate. In episode 8, we're shining the spotlight on epilepsy, a condition that affects millions globally, yet is often misunderstood. We'll delve into how artificial intelligence is aiding in the detection and prediction of seizures, the crucial role cybersecurity plays in safeguarding this progress, and address common questions. Additionally, we'll explore what patients, families, and healthcare providers can do to enhance lives and safety. Before we proceed, I would like to take a moment to be transparent. I am not a physician or neurologist. This podcast is intended to inform and empower, but not to diagnose, treat, or replace the advice of a qualified medical expert. If you or someone you care about is living with epilepsy, please consult a licensed healthcare professional for tailored advice. Here's an overview of epilepsy and impact. Epilepsy affects over 65 million people globally and more than 3.4 million people in the United States alone. It's characterized by unprovoked recurrent seizures that vary in severity. While many can manage the condition with medication, about one third of patients continue to experience uncontrolled seizures. More than 1 in 26 people in the US will develop epilepsy during their lifetime. And tragically, around 1 in 1,000 people with epilepsy die from sudden unexpected death in epilepsy each year. AI tools for epilepsy detection and prediction. Artificial intelligence is revolutionizing epilepsy care. Let's explore how. Wearable technologies such as the FDA-cleared Empatica Embrace 2 smartwatch can detect generalized tonic-clonic seizures and instantly alert caregivers. Clinical trials show up to 100% detection sensitivity with real-time notifications. AI-powered EEG analysis tools are being used in hospitals to reduce diagnostic error and shorten the time to treatment. Machine learning models are also being developed to predict seizures based on physiological data, such as heart rate and skin conductivity, with some models achieving an accuracy of up to 99.6%. Real world AI tools helping with epilepsy. Adding more specific AI driven technologies can enhance credibility, such as NeuroPace RNS system. That's an implanted brain stimulator that monitors and responds to abnormal brain activity. It has shown a median seizure reduction of 75% after 9 years of use. Seer Medical. It uses wearable EEG and AI to capture long-term brain activity at home. It has helped reduce the delay in epilepsy diagnosis. AI EEG analysis. That's from Stanford and MIT research. Deep learning models are now matching or surpassing the accuracy of expert neurologists in diagnosing epilepsy from EEGs. But what is EEG? EEG stands for electroencephalogram. It's a non invasive test that measures and records the brain's electrical activity using small, flat metal discs called electrodes, which are placed on the surface of the scalp. What EEG is used for? It helps in detecting seizures and epilepsy related brain activity, diagnosing brain disorders like sleep issues, tumors, or brain injury, monitoring depth of anesthesia during surgery, evaluating developmental concerns in children with autism, ADHD, or speech delays, supporting AI models to detect patterns or abnormalities in brain function. How it works. Your brain cells, neurons, communicate using electrical impulses. EEG picks up these impulses and displays them as wave patterns on a monitor or recording device. Different brain states, such as sleep, relaxation, or seizure activity, produce distinct patterns of brain waves. These tools are not futuristic concepts. They are transforming lives now, making diagnosis faster and improving seizure management in real time. Why cybersecurity matters? With these innovations come serious responsibilities. Medical wearables, EEG monitors, and remote apps all collect and transmit sensitive patient data. If compromised, they could lead to treatment delays or false alerts. Cybersecurity threats, such as ransomware attacks, have already impacted several hospitals in the US, resulting in delayed critical care and endangering patient lives. Healthcare providers must ensure all devices use encrypted transmission, secure software updates, and multi-factor authentication. Emotional impact and mental health. Don't skip the psychological side. Up to 50% of people with epilepsy experience depression or anxiety. Many report fear of stigma or social isolation. Misunderstanding and misinformation still prevent open conversations. Living with epilepsy can feel isolating. That's why community, mental health care, and advocacy are just as important as medication and machines. You can encourage support groups like the Epilepsy Foundation Connect platform, counseling for patients and caregivers, school or workplace accommodations, practical tips for patients, caregivers, and providers. For patients, use seizure detecting wearables when recommended. Regularly update medical apps and device software. Know your seizure triggers and share them with your care team. Caregivers. Set up caregiver alerts on wearable apps. Learn basic seizure first aid. Keep backups of medical records and seizure logs. Providers. Recommend secure FDA cleared seizure detection tools. Educate patients about the safe tech use. Monitor AI system performance and patient feedback regularly. Call to action for caregivers and loved ones. Offer clear suggestions. Learn seizure first aid, such as turn person on side, cushion head, don't restrain. Know when to call emergency services if seizure lasts more than 5 minutes or injury occurs. Help maintain routine, medication schedules, and social inclusion. You don't need to be a neurologist to help. Just be present, informed, and supportive. What triggers epilepsy? Again, I am not a physician or a neurologist. This podcast is intended to inform and empower, but not to diagnose, treat, or replace the advice of a qualified medical expert. If you or someone you care about is living with epilepsy, please consult a licensed healthcare professional for tailored advice. That said, many epilepsy patients and caregivers find it helpful to understand what commonly triggers seizures, especially when planning daily routines or using smart devices to support care. Here are some common epilepsy triggers: missed or irregular medication. Skipping anti seizure medications or taking them at inconsistent times can quickly lead to a seizure. Lack of sleep. Sleep deprivation disrupts brain activity and increases seizure risk, especially for people with generalized epilepsy. Stress and anxiety. High emotional stress and mental fatigue can raise seizure likelihood in some individuals. Flashing lights or patterns, also called photosensitive epilepsy. This trigger is common in some teens and young adults. Video games, strobe lights, or flashing animations may provoke seizures. Alcohol or recreational drug use. These can lower the seizure threshold or interfere with prescribed treatments. Hormonal changes. In some women, seizures may increase around menstruation due to changes in estrogen and progesterone levels. Illness or fever, particularly in children. Fevers or infections can trigger febrile seizures. Skipped meals or dehydration. Low blood sugar or electrolyte imbalances may lead to seizures in some people with epilepsy. Again, everyone's experience with epilepsy is unique. Some people may have clear, known triggers, while others might never identify a consistent pattern. The best plan? Work with your doctor to track seizures, avoid your triggers whenever possible, and select support tools such as wearables or mobile apps that align with your lifestyle and safety needs. And always remember, no AI device or health app can replace the advice of a qualified healthcare provider. Questions about epilepsy. As we continue today's discussion, I would like to take a moment to address some of the most frequently asked questions about epilepsy. These responses are educational and based on widely available clinical research. But remember, this podcast is not a substitute for medical advice. Please speak with your healthcare provider for guidance tailored to your situation. Are seizures and epilepsy the same thing? Not exactly. A seizure is a single neurological event often caused by sudden abnormal electrical activity in the brain. Epilepsy is a chronic neurological condition where a person has had two or more unprovoked seizures. While seizures can occur from trauma, high fever, or drug withdrawal, epilepsy refers to recurrent, unprovoked seizures. Are there different types of epilepsy or seizures? Yes. Seizures are broadly classified as focal, starting in one area of the brain, or generalized, affecting both sides of the brain. Types of seizures include tonic clonic, grand mal, absence, petit mal, myoclonic, atonic, tonic, and clonic seizures. Epilepsy syndromes include Lennox-Gastaut syndrome, juvenile myoclonic epilepsy, and temporal lobe epilepsy. Is there a cure for epilepsy? Currently, there is no permanent cure for epilepsy, but it can often be managed successfully. Around 70% of people with epilepsy can achieve seizure control with medication, surgery, vagus nerve stimulation, or responsive neurostimulation. Diet-based therapies like the ketogenic diet are beneficial for some children with refractory epilepsy. Are there preventive measures? Epilepsy can't always be prevented, but seizures can be minimized by adhering to medications, maintaining consistent sleep, reducing stress, avoiding non personal triggers, using seizure monitoring tools. Preventing head injuries and treating infections early can also help reduce the risk of epilepsy. Should a person with epilepsy wear a medical alert bracelet? Yes, absolutely. A medical alert bracelet or necklace informs emergency responders that the wearer has epilepsy. It can include details like medication names and emergency contact information. While smartwatches with seizure detection are helpful, they don't replace clear identification in an emergency. So, while epilepsy is complex, it's not hopeless. With innovative technology, informed decisions, and support from providers and loved ones, people with epilepsy can live empowered, secure lives. That's the heart of our mission here at CyberClinic. Global and health equity consideration. Around 80% of people living with epilepsy reside in low and middle income countries. Despite epilepsy being treatable in most cases, nearly 3 out of 4 people in these regions do not receive the care they need. This treatment gap is driven by limited access to neurological specialists and medications, high stigma and misinformation surrounding epilepsy, inadequate infrastructure to support diagnostic tools like EEG or imaging, economic barriers, especially in rural and underserved communities. Many individuals are socially excluded, face discrimination in education or employment, and are at greater risk of injury, poverty, and early death. Achieving health equity means expanding access to affordable care and anti-epileptic drugs, strengthening local health systems and workforce training, addressing cybersecurity gaps in mobile health and tele-epilepsy programs, investing in AI-powered diagnostic tools that can operate with low bandwidth or offline. To conclude, epilepsy doesn't have to mean living in fear. With AI and secure digital tools, we can detect risks more quickly, support families more effectively, and protect patient health with greater resilience. The key is combining smart tech with strong cybersecurity, education, and compassionate care. What if we viewed epilepsy not only through a clinical lens, but a digital one, where AI, empathy, and cybersecurity could work together to restore dignity, predict danger, and improve outcomes? That's the future we're exploring at CyberClinic. Join us next time as we continue exploring the future of healthcare, powered by AI and protected by cybersecurity. In our next episode, we'll take a deeper look at autism, how families are navigating this complex condition, and the ways AI tools and cybersecurity are reshaping support, diagnosis, and safety for neurodivergent children and teens. It's a robust conversation that blends compassion with innovation. You won't want to miss it. This is Claude Bernard for CyberClinic. Until then, stay informed, stay secure, and stay connected. Thank you.